Welcome back now at 8:15. The FDA approved the first blood test to screen for colon cancer. The test is not aimed to replace colonoscopies, but it could boost the low rate of screenings and could potentially save some lives. Joining us to discuss this medical advancement is Dr. Reena Mehta from Uptown Allergy Asthma. Good to see you.
Good to see you. Good morning.
Yeah, so this is interesting. We've heard about this. Obviously, a colonoscopy is kind of the gold standard of checking for colon cancer, but there have been some other methods, and now this is one that seems very painless.
Yes, very painless, and hopefully will be covered by insurance soon. And so we think of colon cancer as a preventable cancer. It's one of the few that we can actually prevent, but it is also the second leading cause of death by cancer in the United States. So it's a big deal. And so we're finding that our younger patients, in the 40s and the 50s, there's actually a trend in increasing in these patients with colon cancer. And so the guidelines are to start screening at 45. And of course, while colonoscopy is the gold standard, it's hard to do. You have to take a day off work, you have kids, the prep, if you've ever had it done, believe me, anybody that has, it's not pleasant. And so that tends to make people not go and get screened. And so this test called SHIELD, which is a blood test detecting for colon cancer, may be a good option for you.
Okay, it definitely, colonoscopy is not something people, have on their bucket list per se. Like, I can't wait to do this. But having a way that you could just submit a blood sample could really be a game changer. How effective does this seem to be, though?
So that's a great question. So what the data shows is that there is about an 83% detection of colon cancer when you use this test. So it is going to detect about 83%. Where it's most likely effective is detecting your higher grade cancers. So there is a concern that 13% of the time it may miss some of your polyps or your lower grade cancer. So again, not a replacement for colonoscopy. If you are at high risk for colon cancer, meaning you have a family history of colon cancer, you should still get a colonoscopy. Now, let's say the SHIELD blood test does come out positive, which suggests that you may have colon cancer, then you still do need to get a colonoscopy to further grade the tumor and figure out treatment plans and et cetera, et cetera. But if you're dreading going to get your colonoscopy and you want another option, this is certainly a good option, especially if you're not at high risk.
Okay, so maybe not like the ultimate best way to do this, but if this gets more people checking, it's a good thing, right?
That's exactly right. And so, the screening for colon cancer, a lot of people just don't do. And so if it gets more people out there to do it, and hopefully soon we will have insurance coverage for it, because otherwise it can be a very pricey test, but it's painless, like you mentioned. And the way that it works, it's detecting the DNA that's released from tumors. And so if you're releasing a lot of cancerous DNA from tumors, that is how it works, by detecting that in the bloodstream. And so obviously if it's a higher grade cancer, it's going to release more DNA, and that's why it's able to pick up more of your higher grade tumors and cancers.
It's very interesting stuff, and I guess you can only assume that these types of processes just get better over time, right?
Absolutely. This is our first FDA approved blood test. Of course, we're going to have to compare head to head with Cologuard. We're going to have to look at other blood tests, but at least this is a great option for people who probably aren't going to go get screened anyway.
All right. Thank you very much. We appreciate it.
Thank you for having me.